The City of New London is at the regional center of a growing shift towards significant and innovative approaches to building a community culture of health. Growing understanding of the role of social determinants is creating the opportunity for new policies, approaches, and implementation strategies to take effect and broaden the view of healthcare reform. The homeless response system is also changing from providing shelter to achieving housing stabilization as quickly as possible.
It's a safe place, and that's her mission, to come to a safe place, to be able to eat, to no one to to bother you or enjoy a meal. But not only do we also help people, not just, it's really beyond food. I mean, we're always like someone's question or help someone get to this, this place and that place. We have a nurse. We have a nurse that comes, twice a week. We have a nurse here. One lunch and one dinner. We work with different agencies, and we try to work together as much as we can. Just like the food, the Gemma Moran Food Bank, we get most of it. Well, pretty much, big percentage.
With a lot of folks, because it really takes the community to help the food center work. We actually have, we rely on hundreds of volunteers with the work in the back. Accomplishment, I would say, is that 50% of all the food that's in the warehouse, so think about that, too. 2.3 million total, half of that actually comes from local donations. That's food drives from the community.
To best illustrate how the community works together across health factors, sectors, and organizations to improve health outcomes, the following anecdote is provided by New London's Human Services Department. The week of December 12, 2016 was one of the coldest in almost a year in New London. There was great concern about individuals who are homeless, living in tents, condemned and abandoned buildings and cars. The City of New London, in partnership with the Homeless Hospitality Center, New London Fire and Police Departments, New London Meal Center, and healthcare providers, immediately developed and implemented a plan to identify, locate, and engage those who were in need of shelter and food. The plan included emergency phone calls between providers, police, fire, City of New London Human Services Department, and a social worker at Lawrence Memorial Hospital.
The Respite Center at the Homeless Hospitality Center was based on a model seen in other communities, and the Homeless Hospitality Center came to Lawrence Memorial and made the proposal that they wanted to establish these respite beds. And Lawrence Memorial was the first sponsor for this program and has continued to sponsor that on an annual basis to a significant degree to ensure that that resource remains available in the community. There is a group that is convened through the Homeless Hospitality Center called the Community Care Team. They convene on a weekly basis, and they consider very intensively the cases of individuals who are homeless and face other challenges.
Shared information is enormously helpful, and we use the Homelessness Management Information System, often referred to as HMIS, which now, 10 years ago, actually didn't even exist in Connecticut. Then it got started, and now there is actually fairly good data sharing within the homelessness system. Find out where they've been and who they may have worked with before.